Good afternoon, everyone. I'm here to talk to you for 7 minutes. And I'm going to tell you who I am. I'm going to talk about a little bit about Ferring Pharmaceuticals, talk to you about the Heartbeat program and why it came to be and what are the next steps. So here I am. So I've been in pharma it's actually a lot more than 35 years, but I've been in the fertility space for the last 27 years. And I started the fertility sales team at Organon in 1997. I developed the Heartbeat program, which I'm going to get into in a few seconds. And then I've also been the driving force behind the creation of the Alliance for Fertility Preservation, working very closely with Joyce. And before that, originally with Dr. Rosenwax at Cornell. So what about Ferring? We've been around for it's privately owned. So what does that really mean for us as a company? It means that we can do what's right for patients. We don't report to stockholders. We don't report to Wall Street. So we can do what's really, really right for patients. And what we're doing is where our focus is on increasing access and outcomes, of course. And we know that not one size fits all, which we're hearing all day, that the inequities by race, by income, by whatever, one size does not fit all, and there's not one silver bullet or one solution. And we've been working very closely with the Alliance for Fertility Preservation, with Resolve, with ASRM, and we have a government affairs team that works very closely with all of these agencies to really get more access to care and improve the legislation. And we've been fairly successful. So here's the Heartbeat program. Why did this come to be? Like I said, Ferring does what's right for the patient. And I said, look at the outcomes of the people, newly diagnosed cancer patients, and their survivalhood was so remarkably higher than it had ever been in the past. And I said, why is it that we can't do something for these patients? They didn't ask to get cancer. Let's try and figure out a program for them that we can help them in their journey and let them realize the dream and the hope of having a family. So thus the Heartbeat program. So with this program, patients can access some of the fertility medications by Ferring at absolutely no cost. So what's happened over time is that there have been legislation happening, and I'll show you the map in a few seconds, in about 18 states. So I went to upper management and I said, look, what should we do? We work with Walgreens as our key partner for providing the product to patients. There's 3 states where Walgreens can't operate, and that's New Jersey, Massachusetts, and Arkansas. We have Mandel's Pharmacy in New Jersey that handles those patients. But it was like, what can we do? So what should we do? Should we have them do the laborious work of trying to verify the benefits? So we said, no. The intent of this program was to help patients, to remove barriers. And so that's what we did. The intent was to continue to provide these products at no cost to these patients and not make them jump through hoops and no barriers. And we've been able to continue this program. We started in 2012. So the program's been around for 13 years. And I'm very proud and honored that I launched this program and it's still working great today. And to date, with the Walgreens data, we help about 1,800 patients a month, but we've helped now, not 1,800 a month, 1,800 a year. But now, over time, we've helped over 30,000 patients get access to drugs for their fertility preservation for Oncofertility. So who's eligible for this program? So you have to be a U.S. citizen, get a diagnosis of cancer. We've now expanded the program to include anyone with any kind of a treatment that they need to be treated with gonadotrophic drugs. So those patients are now part of the program, and not have chemo within 12 months. So that's if they've already gone through chemo, they have to wait 12 months. So that's our research question is, when is really the right time that they can start the preservation post chemo? And we would love to get that answer because we know that there's some information in the literature that some people are doing it at 6 months, 8 months, 12 months. So really, it would be good for us to really understand, does it really make a difference? Number one. And number two, does it matter what the drug, the chemo drug is that can impact that? And then as we talked before, no federal employees and the same thing with Medicare patients. So then also the Alliance for Fertility Preservation, because we started with Heartbeat, but that wasn't enough. We needed to move further because I said, we've got this program, but nobody knows about it. So we need to get some general awareness for people to understand the program and be able to access it. So thus was the creation of the Alliance for Fertility Preservation with the Heartbeat program. And then with that, Joyce worked together with the team and we created the Fertility Scout, which has the list of all the clinics that have signed up that will see patients within 48 hours after their diagnosis. Here's the map of the 18 states. And just as I started out, not one size fits all. Not one state is the same as the other. Some just have a few laws passed and that's it. And so the coverage is very limited versus Illinois, where it's, probably the best coverage in the United States. And then at the end, I'm just going to close with this. This is our mission at Ferring, to put parenthood within reach for anyone who wants to have a family. And I just want to put in a plug at the end here that we've all now Ferring's just launched these health equity modules at ASRM. We worked with Morehouse Medical School because we do understand the disparities in healthcare. And so with that, we have these modules that are online. If you need some information, we can get that information to you, but it will help educate the staff in terms of the journey of the Black woman. That's just the first step. We're going to go to all the different cultures just to get the clinic staff and to understand. But with the Morehouse program, you can get a seal of completion. You can put that on your website, which will help to draw these women into your clinic where they know they'll get a better experience. With that, I say thank you, Irene, for inviting me. It's so much fun for me to share all this information because it's really an honor to be here. Thank you.